Hey there, good Friday afternoon to you once again. I'm Tre Tailor, and welcome to Coping with COVID. This is information on the pandemic and updates to help you thrive and survive COVID-19. Once again, I'm Tre Tailor, and we already had a great show today. Thank you so much for joining us. We talked to State Representative Gilda Cobb-Hunter about some of the amazing things that they are doing in the legislature, and a op-ed piece that she penned to the National Black Caucus about the health disparities causing so much more issues with the pandemic and opening up the country too much, too soon. But right now, what happens if you do have COVID-19? What do you do if they tell you to self-isolate? Well, today we're going to talk to you about that. Self-isolation 101 in the best of situations. And we, talked about Oprah Winfrey putting Stedman out in the guest house. Well, everybody doesn't have a guest house. And then we've seen so many celebrities like Chris Cuomo, the CNN anchor. He was in his basement, in a beautiful basement, fully furnished, bathroom, the whole nine. His wife ended up getting it. She ended up giving it to her son. So if you are in the best of situations and you can still get it, what happens when you're in a one-bedroom apartment with one bathroom and everybody in the house is right there with you? How do you self-isolate safely and securely and not expose your family and friends? Now, of course, you could have it, but you could even be someone who is an essential worker and you're around it all of the time. So how do you handle that? Well, today we're going to talk about that on Coping with COVID. And we've got some amazing physicians with us today. Dr. Alexea Gaffney is a triple, 1, 2, 3 board certified infectious disease specialist. She's on the front lines in Long Island, New York, working with COVID patients. She's also a mom, a speaker, an author, and also a breast cancer survivor. Dr. Alexea Gaffney, thank you so much for joining us from the NYC.
Thanks for having me. Thanks for having me on.
Thank you. Dr. Z, Zarinah Hud is a sports and integrated pain specialist, and she's in Atlanta, which just now opened up the whole daggone state. I'm not coming there. Nicole and I talked about this last week. We're not coming to get our hair and nails done, girl. Y'all keep that over there. We're going to keep ourselves over here. But actually, Dr. Z was exposed to someone with COVID-19. She started having symptoms and she had to self-isolate. So she's been there, done that. So we're going to talk with her also. And then a familiar face on Coping with COVID, board certified physician, Dr. Nicole Edwards is with us once again. Cole, thank you so much, not only for joining us, but for putting together this amazing panel of your contemporaries, of your colleagues. Thank you.
No problem. Thank you, Tre. I'm so happy to be here always.
Yeah. Thank you. So Dr. Z, let's talk to you first, since you had it. You, like I said, you've been there, done that. How did you first find out that, you were exposed?
Well, thank you, first of all, for having me on this platform. Thank you so much. It's been an honor and a pleasure. And yes, so the first time I was exposed was now probably 3 weeks ago or so. I've been back working about 2 weeks now. We're almost finishing 2 weeks of me returning back to work. And I was exposed by a colleague, actually, at the time. And so for me, at the time when I was exposed, it was not confirmed that person was exposed, and that person had no idea. And then probably 3 or 4 days later, I started to develop some symptoms, which I'll be a little bit more specific in a second. But in hindsight, I actually probably had some symptoms prior to that, and it was only in hindsight that I realized that I did have a loss of smell.
Wow.
That I took to be allergies, because I was dealing with my allergies as well. So I kind of dismissed that small part, small but big, part, because I was already dealing with, again, like I said, allergies, and otherwise I was healthy. And I also was, even at that time, wearing PPE, and had been for quite some time. So it wasn't until my symptoms kind of advanced, I guess you will, when I started to develop severe GI symptoms. nausea, vomiting, as well as diarrhea. But I really say it was more like water, quite frankly. For those who have squeamish ears, I'm going to be graphic because I want to save lives. So this is a little bit more, I'm going to be as descriptive as possible so that you can be aware of your own symptoms.
Yes.
It was, and then I went into quarantine at that time. Probably 3 to 4 days later, after I was being quarantined, I found out that actually, definitively, I was exposed to a positive COVID-19 individual, who then was, of course, also isolated. But that was only probably 4 to 5 days after my obvious symptoms had started that I became aware of that definitive COVID-19 exposure.
Right. Dr. Alexea, so Dr. Z said, and I know this because we talked earlier, she said that she was, as just you said, she was exposed. She didn't have any real symptoms other than, the loss of taste, which it didn't kind of key into her. Why is this so much more infectious? Why is this so much more, I don't know, easier to catch than anything else?
It's because of the nature in which it spreads. So it is, you remember in the beginning of this, everybody kept saying, is it droplet? Is it airborne? Is it droplet? Is it airborne? Well, we know it's both now. So when something is airborne, I don't ever have to cough or sneeze or, anything in your presence. Just the way we are having this conversation now, if we're all in the same room while I'm speaking, I can fill the entire room with infectious particles.
Wow. And just because I'm breathing and I'm talking.
Just because you're breathing and talking. And think about, like, if you laugh, right? Like, how much more breath and
I'm pushing it out even more.
Pushing it out, right? Think about, so that's why, like, our gyms are closed, because you could wipe down gym equipment, but when you're running and you're exerting yourself and you're breathing deeply, you're just spewing out infectious particles without ever having to cough or sneeze, which is what we have it set in our mind spreads infection. So that's why everybody is now being asked to put a mask on, since we can't sit our butts down and stay home. Everybody cover your face because y'all can't stay home.
So Dr. Alexea, though, but is this infection, is this disease, is this antibody just so much worse than, because listen, we're always coughing and sweating and laughing and talking, and we can always get something. So is this COVID-19 virus worse than, obviously it's worse than the flu, worse than so many other things?
Yeah, so it's worse than our common cold, right? You may have heard people say, oh, well, coronaviruses fall in the common cold family, right? But this is a different strain of the virus. And this virus is what we call more virulent. It causes much more severe infection, right? When you get a cold, maybe you feel miserable or crummy, and that's a relative term, for a few days, and you're congested, you're coughing, but you don't get pneumonia. Your liver isn't impacted. Your kidneys aren't impacted. You're not at risk for a heart attack or a stroke. Your circulation doesn't clot off. This infection has proven to be so much more virulent, or so much more of a powerful infection causing virus compared to so many of the other ones that we've seen in our lifetime. And that's the problem here.
Yeah. And do we know why that is?
We don't know the specifics of why, but what we know is that it's setting off what we call inflammatory pathways, or it's causing cytokine storms. So literally it's igniting every system and every pathway in the body that fights infection. And the body is doing such a good job of fighting the infection. It's like almost killing off the host too. So for all of the initial sharing that people with immune suppression were going to do worse, people who are older were going to do worse, while that still holds truth and holds weight, there are patients who we are who we feel their suppressed immune system is actually what saved their lives or what caused them to have a more mild illness. Because in the people who are sickest, if we measure all of those markers of immune response and inflammation, we call them, they're through the roof. I've never seen labs like this in my lifetime as an infectious disease doctor. Yeah.
Wow. Yvette McQueen is watching. Want to thank everyone for watching. Major Knowledge Power, Yvette says. Thank you so much, Yvette, for watching. Please continue to post and share this information out because we need to inform and empower our community. Dr. Nicole, I guess that is also why the newness of it, why it's so important to be vigilant, not only with the washing and the mask wearing and the everything else, because there's no a vaccine for it. We got the new symptom almost every week.
Yeah.
And so it's the newness of it, and along with everything else Dr. Alexea and Dr. Z said, the newness of it, the big issue.
It's not even so much the newness of it. It's that, yes, it is the newness.
Uncertainty.
It's the uncertainty, right?
Yeah.
Because even as doctors, we are learning. We talked about this earlier in the week. I promise you, probably 5 times a day, I'm getting a new update, a new journal article, a new, oh goodness, here goes a new symptoms. Here goes a new presentation. Here's a new, try this to treat it, or maybe this, or maybe. So the problem is it's uncertain and we're not sure exactly how to treat it. We don't know. And that's the problem. When you don't know, we can't attack it first on. And so it's this newness, yes, but with the newness comes the uncertainty, and you have to just try, and sometimes with trying, it works or it doesn't work. And yeah, so right now, that's what we've been trying to express to people, just the brevity, this is way stronger than what people are. We're not taking it as serious as we need to, right?
Yeah.
And so we tried to make it, oh, it's just a cold. No, it's not. Oh, it's just the flu. People die from the flu. Okay, they do, but the flu is not, like Dr. Alexea was saying, the flu is not attacking every single system in our body, right? And this is why this is how I treat everybody like they have it. So everybody just needs to stay away and stay back, we don't know yet. And that's the problem. We don't know.
Yvette McQueen says it's like a 4-month-old baby changing personalities every day.
Every day.
Yeah. Yeah. And then, of course, Dr. Z is people are asymptomatic. So we've got people that are walking around. They don't have any symptoms, or maybe they've got a new symptom and don't know that that's a symptom actually. So if you put on top of, I don't know I have it, and I don't even really believe it, and I don't want to mess up my makeup and wear a mask, just stuff like that, then the incidence of it spreading is even greater. Because you said the person that you were infected by didn't know that they had it, correct?
And I even want to clarify the point that, in this particular case, as you just pointed out, what I know is that I was confirmed to be exposed to a positive confirmed case. But what I don't know is she was absolutely the only one that I was exposed to, right? Because again, as a physician, I see patients and I see COVID-19 patients, right? Not on occasion. I mean, like Dr. Nicole said, until otherwise, proven.
Yeah, you're guilty until proven innocent.
Right. And I can't tell you, there's countless numbers of patients who have, fairly classic symptoms that have not been tested. So between herself, the person a colleague or whatnot that I was confirmed to be exposed to, and other patients as well, or even other colleagues for that matter, what did my viral load look like? At some point we have to, and that's not the average person thinking of that, but we understand as physicians that matters. And so the manifestation of as relates to that. So yeah, I didn't know, she didn't even know until she knew, right? That she was COVID-19 positive. And even in my case, just for your listeners and audience to be clear about it, my test actually ended up being negative, right? So, what we had to be aware of is what percentage of patients or individuals out there who are classic COVID-19 in terms of how we understand the disease to manifest itself are potentially false negatives. And we're getting the studies that are coming out more and more. That could be upwards of 30-35% false negatives. So, did I fall into that category? For all intents and purposes, I did, for sure, right? When you match out all the other things that were there. So as a physician, I know I speak for many of my colleagues, but maybe not all, but for me, for sure, I don't treat the test, I treat the patient. So in those individual situations, we have to be very clear about that. And I want people to be able to hear this broadcast today so that they can advocate for themselves and their loved ones, because they realize that, oh, okay, a negative test, but all these other symptoms, or a negative test, but I'm literally sleeping in the bed with a positive COVID-19 individual. Okay, my test was negative. Do I walk around the world now like I'm negative?
No.
Again, we have to put on our different hat. And I never, actually, even pre-pandemic, I never relied on tests to care for my patients. There was just another tool to potentially validate what I already see. But often, many of us physicians, we treat the patient. This is not the first time we've dealt with tests that didn't coincide with what we were looking at in front of us. And we don't turn our eye and say, oh, test was negative. Oh, well, go on home, have a good day. We treat the patient accordingly to what we understand based on the knowledge, based on the data, and based on what's clinically in front of us.
Yeah, Dr. Zarinah Hudd is with us. She is a mind, body, and spirit specialist. Also, she works with pain and medicine in Atlanta, Georgia. And of course, Dr. Alexea Gaffney is a triple board certified infectious disease specialist. Dr. Nicole Edwards also joins us from Columbia, South Carolina. She's a board certified general practitioner in Columbia, South Carolina. And we're talking about self-quarantine 101. But we wanted to first talk about the disease in itself, how you contract it, how it's so important that we protect ourselves. And we do have a question, but before we get to the question, ladies, I want to talk something about what Dr. Z said about this 30%, and Nicole mentioned it earlier this week, this 30% rate that a test could come back falsely negative. 30%, that's a high. You might as well just have it. That's very high, Dr. Alexea.
Yeah.
How can we have a test? Let me just ask this. I know I've asked 15 questions in this setup, but how can you have a test that it's 30% that you may have it or you might not have it?
So the reason for that is a couple of different things. But the first thing that you should know, and the audience should know, is there is no such thing as a perfect test.
Okay.
Tests are made such that they will pick up most of the true positives, but you don't want to over-diagnose, because sometimes there's more harm in scaring someone and making them believe that they have something that they don't, because is this test result going to result in surgery or a lifelong commitment to medications? Is it just going to cause mental distress? So you don't want the test to be so sensitive that you get a lot of false positives, right? Because then what do you do with the false positives? With a false negative, we all have the ability to say, well, my patient fits the description, they've had the exposure, even though this test is negative, I'm going to consider that they have this infection, they have this disease, they have this diagnosis, and I'm going to treat accordingly. So we err on the side of caution, and we go with just a slight edge on false negatives versus having false positives. The other thing, though, is user error of the test. And so this is a fight I'm always having with my patients, because they love to say, I read the test is unreliable. Well, the test, like the specificity, so how often it or the specificity is, do you get false positives or false negatives? The sensitivity is how often does it pick up the infection or the diagnosis when it's there, right? That also is dependent upon the use of the test. So is the timing right? So if you go in too early for some tests, you're going to get a false negative. Did you get a good sample from the test? So when you're testing for COVID, you're doing what's called a nasopharyngeal swab. So you're taking this little flexible swab that's very long, right? Just like Dr. Nicole is doing. Go up your nose, and it needs to go back and touch the back of your throat, nasopharyngeal. And if you've been following this COVID situation, and if you've watched other providers, you will also notice that some places you get the nasopharyngeal swab and you get an oral pharyngeal swab, and they go into the same media to go see if there's this viral RNA present. On top of that, some places have even had the patient spit into the same tube to increase the yield of the test. Okay. So sometimes the provider themselves just is not doing the test right? Exactly. You have people of all levels of skills and experience administering this test. You lay people who are just willing to suit up and go stick this thing up somebody's nose, and people who are very experienced and understand exactly what they're going after. So I have to say to people, when you got the test done, was it uncomfortable? Because if it didn't hurt like heck, if you didn't want to pull that thing back out your nose, then you probably didn't get a good sample. I have people say, oh, it just tickled the inside of my nose. No, this is, if you're using the word tickle in association with having a test, then
you didn't get a good test.
Error. You didn't get a good test.
So Dr. Alexea, do you need to say, stick it in there harder, stick it in there harder? My nose is not bleeding yet. I'm not bleeding. Get the blood. I mean, say that.
So one, you have to prep the patient for the test, and you have to let them know what they're in for. You have to help them anticipate the discomfort so that they don't run from the test or prevent them from running. So in my office, if I'm doing a nasopharyngeal swab, I lift up the back of the exam table so that thing is above my patient's head, and I hold their forehead with my hand, and then I go for it.
My nose hurts right now. My nose hurts.
It's uncomfortable.
But it hurts right now.
So it's timing, it is sampling, and then it is what we call the sensitivity and specificity of the test all get together and give us that false negative rate. So I would imagine, I would bet that some of this false negativity is just sampling error, just not getting a good enough sample.
Right. Lauren Powell says her mom says they stick the swab up your nose until it reaches your brain.
Yeah.
Wow. Yes. Now, is it also the reason why there's so many false positives or negatives because of the newness? Does it go back to the newness too? I know Dr. Z and I were talking earlier about the fact that there's so many tests and they've been kind of rushing these tests. So are some of them not as accurate?
I mean, that's definitely a possibility. So you definitely want to go with an FDA approved test or platform. You can buy approved and non-approved tests. So you really for the test that you're getting is tried and true.
Wow, that's interesting. So you can get a non-approved test.
Yeah, and there's about 28 or so kits that have been on some level approved, like you said, FDA or non-FDA approved, that are actually out there. And you don't always know which kit that lab is using. Not all physicians are even necessarily privy to know like which are the better ones versus the others to even request it. So we have to consider it all, and that's really, I totally agree with Dr. Alexea. All of these are variables, right? They're all variables into this what we're dealing with. Not to be too technical about it, but it's important for people to understand that basis, because that allows you to better understand when we're talking about it in real time. People, when the tests come out to be that, and they're also exposed to patients who are confirmed, what does all that mean? Did they go to different test sites? You have some situations in some families or one household at different stages. Maybe one went to one test site and someone else went to another testing site. So they didn't even have a consistency of again, the user in terms of how that test was administered. All of these different variables that we don't unfortunately get to always control. We don't get to control all the variables, but the variables matter so that you can have context to the conversation.
Gotcha. Yvette McQueen wants to know, does it matter how long you're exposed to someone in relation to if you contract COVID-19?
I'm going to say yes and no, right? So if there's a household contact, right, then there's the repeated exposure, which increases the risk. But you can have a brief exposure with someone and it be just as bad or worse with the constant contact you have with a family member or significant other. So, you know, we talked about this thing being airborne or not. If someone coughed or sneezed in your face, right, that holds different weight, that exposure, than you're in the household with someone who's seemingly well and you guys are still within the household practicing social distancing because that person is coming and going. So maybe they're wearing the mask, or maybe you're just maintaining the 6 feet distance from one another and sleeping in separate bedrooms. And then the other thing is just remember, it's not just the airborne and the droplet borne, but the fact that the virus can live on hard surfaces and you might pick up the virus in other places. So you technically don't have to be exposed to anyone at all. And that's why folks are wearing gloves out in public. The problem with the glove situation is people wear the gloves, touch everything. They're more likely to touch things because their hands are protected, but it doesn't stop them from touching their face like humans do 120 times per hour on average. Right? Or it doesn't stop them from touching their cell phone or digging for their car keys and things like that. So you don't have to be in contact with anyone, but your level of exposure or the severity of your exposure is dependent upon what the people you're exposed to are up to. So those of us who are going out to work are all frontline workers, you know. My daughter's father had COVID. He is he's in law enforcement. And he basically knew that. He just straight up said, I'm not going to come visit. We'll do the FaceTime because I know that I'm exposed by the nature of my work. And I'm just afraid to bring it to your house and bring it to you or Kennedy. So, and sure enough, he got it. But his risk was very predictable. So when you're dealing with a situation like that, right, you just might as well operate as though you have it and maintain the distance.
Well, isn't that for everybody though? I mean, yes, he's on the front line. You guys, the three of you are on the front line. But if we step outside the house, go to the grocery store, go to the drugstore or wherever, aren't we all potentially exposed? Shouldn't we all act like we could get it? Because again, we don't know who has it. A lot of people aren't wearing masks. And I want to talk about this before we get to the quarantine. It still boggles my mind that if I wear a mask, I'm not protecting me. I'm protecting you from me, you know? Dr. Alexea Gaffney is joining us from New York. She's a triple board certified infectious disease specialist, along with Dr. Zarinah. She's a sports and integrated pain specialist. And also in Columbia, South Carolina, general practitioner Dr. Nicole Edwards joins us on Coping with COVID. I'm Tre Tailor. We're talking about self-quarantine 101, but we wanted to get out some information about COVID-19 before we go to that. So let's talk a little bit about this mask situation. Okay, so I have on a mask. And like I said earlier, I said this to Dr. Z. I'm not a physician. I don't play one on TV. And I just don't know this stuff. I just don't. So I'm speaking to, but listen, when I had the 3 hairstylists on, I also said, I don't know how to do hair. I either head wrap. So, let's talk to the lowest common denominator, who in this case is me. So why is it that if I'm out here doing what I'm supposed to do, protecting, with my cute face mask, and why doesn't that protect me? Like if someone spits, and I love you, y'all say spittle. The first time let me just say side note. The first time I heard that, Nicole said, I was like, what does that mean? I never heard anyone say spittle. Anyway, that's a doctor term. Obviously, we say spit out here in the real world. So if somebody's spitting in my face, why isn't that protecting me? I don't understand. Am I alone with this, y'all? Come on, give me some thumbs up. Tell me, Tre, you stupid. But why? Anybody? New York, Columbia, Atlanta. Let
me see if I have a mask in my bag, because I usually do.
Yeah.
And I'll explain why the mask doesn't work and why the mask isn't perfect. All right. So here's one of my masks.
I want you to see what it looks like now. So I have a can of disinfectant spray, right? Right. But I'm spraying it. Y'all can see that, right?
Yeah.
Okay. Yeah. So when we talk, That's like spittle. Okay. So you see how it's spraying? That's what happens when we talk.
But Cole and Dr. Cole for everybody else. If I got my mask on all good and tight, that should protect me from you spitting on me.
No. So, you know, we're out here in fabric masks, bandanas, all this stuff.
Right.
And think about, like, hold up a piece of fabric to a light bulb and see how much light comes through there, right? If you can see the light through the pores in the fabric, that means that mist of spray, that those air droplets and those spittles can potentially penetrate the mask. So the size of what you're wearing, like how much it can filter out, is important. And then just the mask is not perfect. Okay. So this is just a plain old boring surgical mask, right? And first of all, do you even have the doggone thing on right? Because so many people have come into my office with their surgical mask on upside down. So there's a little piece of metal that is supposed to press this firm to your skin, but it's not perfect. I don't know if you can see my glasses steam up when I breathe out.
Oh, yeah.
But, so there's all this space. So up in here, the air particles can get in. Over here, it's loose, right? So air particles can get in. Up under here is loose, air particles can get in, right? If the mask gets saturated from your breath, right, it gets wet because you're in it all day and nobody has an abundant supply of mask, that also impacts the permeability of the mask, okay? So that's an issue. And then the other thing is, even let's say you're in an N95 and the vast majority of what's in there is not penetrating the mask, it still sticks to the surface of the mask. And then you're handling that mask, or you're reusing the same mask, you're taking it on and off. You know, are you contaminating your hands? Did you flip it inside out? I can't tell you how many people come with their mask inside out. Did you have it on the right way previously? I mean, there's just so many layers to this. And then people have the false security that, oh, I have an N95, so I'm even safer. If you've ever worn an N95 and you've been appropriately fit tested for it, it is challenging to breathe in an N95. So if you can run through Costco or the grocery store, have a conversation, laugh, and push the groceries, that thing is not doing a thing for you.
Really?
You might as well have this or bandana or anything else on but that N95, because when it is sealed to your face, it cuts and digs into your skin, and you wouldn't be comfortable just keeping it on. And you cannot walk, talk, breathe, laugh, and grocery shop in an N95 that is well fitted to your face.
Right. And if it's not well fitted, then it's not fitting well.
Air just leaking in all around the mask. So the mask is not perfect. So the way we get the best results is for everybody to be in a mask. You and I, if we're, face to face, we still need to maintain the 6 feet distance. And with the mask on, if you're the one, I'm putting the cooties on you, Trey. If you're the one with the cooties and you're the one breathing them out, then your mask will catch the vast majority of it, but not all of it. So if you coughed and stuff leaked out or spewed out and went into the air, well, then I have my mask on so that I'm not picking up those spittles and those droplets and those aerosols and breathing them in, but they could still be on the surface in other places. So if I touch them, I'm still in trouble. So that's why there's also the emphasis on hand hygiene. So good hand washing or disinfecting your hands if you don't have soap and water available.
And then Dr. Z, you say too, it's how people remove their masks, which also makes them susceptible to still getting it, even though they have the mask on.
Exactly. That's something that I think we definitely all can do a better job. I try my best to, like she said, anytime I see it, even in strangers, some of them are probably annoyed. But I just want to really help people if they're open to it. But how are we taking it off? Just like Dr. Alexea mentioned, a lot of us may just grab it and we don't even think about it. And then you throw it away. And in your mind, you might even throw on some hand sanitizer. But how do we actually? A lot of times we do it and we do this and we're done. But did you do this? Did you do this? Did you go up to the wrist? Most of us don't.
Yeah.
So all of these go consider that in terms of how you're discarding of the mask. You want to come from around the ears, right? So you're not just grabbing it from here. Yeah. And then when you do that, really should be doing it near a sink or whatever, so that you can immediately wash your hands. I always say soap and water is still king. It still is the only thing the kids see, Diff. I mean, I don't know. Doesn't kill seafood. So salt water is still king, in my opinion. So you want to make sure that you're doing that and doing it correctly. People don't even wash their hands correctly. We want to make sure that we're doing that so that we can reduce that risk. But the way we wore it, that was a beautiful demonstration that Dr. Alexea just gave. You saw all of those room for error, right? You see, like there's so many room for error, and then of course discarding it. How you discard it matters. So you just want to minimize that and be conscious of it at all times.
Great. Superior Edwards says he thinks his math works because he just puts it over a light bulb, no light shining through. Now, I'm sure it helps that he is Nicole Edwards' husband. So
you know, I'm gonna make sure he has on the right mask now.
Right,
y'all.
that's right. Now, come on, Superior. All right, so we are talking to Dr. Alexea Gaffney, triple board certified infectious disease specialist, along with a sports and integrated pain specialist, Dr. Zarinah Peace, and Dr. Nicole Edwards, general practitioner from right here in Columbia, South Carolina. So Dr. Z, how did you self-isolate? And you have children in the home?
I do have young children, ages 7 and 5, husband as well. Don't remember how old he is, but he's the
age that he could catch it.
No, I did. I had to just a little humor there for y'all, but no, I did. I had to quarantine there. It is tough, you know. It was pretty heavy, almost equally as heavy as the actual symptoms was the mental component of it. Only because I had young children. Had we not had children, or they weren't as young, it might not have been as difficult. And it was difficult mostly because it was difficult for them. They didn't mind me traveling. I do travel quite a bit pre-pandemic. But they knew the circumstances, and they also, so that played a role into them, their ability, how they were coping with that. And just in terms of not being able to see me, knowing I'm in the home, but they can't see me, touch me, you know, those kind of things. But in terms of my quarantine experience, if you will, we immediately quarantined myself, probably the first day of my overt symptoms. I'll put it like that. Because as I mentioned earlier in this broadcast, I did experience the loss of smell and taste, actually, but predominantly more smell, and I didn't really hone in on it as early. So I wasn't really quarantined at that time, although I was taking a lot of precautions because I see patients every day. So my routine was, you know, when I left the home in scrubs, and then I would return and I would discard of my clothes at the door, go directly to the laundry room, discard there, clothes go into the laundry, to the washer machine, washer goes on, and then I go take my shower, and then I can come around my family. But even in those settings, I was still distancing myself. So it wasn't a lot of hugs and kisses. Again, young children, that was pretty difficult. But not a lot of hugs and kisses prior to that. And then I got sick. So it was immediately isolation from all of them, and, you know, beyond the 6 feet, just really locked into a room. As someone mentioned earlier, I can't remember, one of you mentioned about the luxury, right, of Kumo and other people that have the luxury to literally be isolated. And I did have that luxury, and from that respect of having a room that had a, you know, tea kettle, you know, bathroom, closet, that, you know, I didn't have to leave that room. In that respect, I'm actually grateful and fortunate from that perspective. However, you know, we've had to give a lot of education, consultation to patients, telemedicine wise, where I've had to help them navigate and strategize. How do you isolate when that is not set up? Exactly. A case in point, a most recent situation was a person who lived in a 2-bedroom apartment. There was one bathroom, and there was a single mother, right? What do you do? And father was not in the state, right? So what do you do? And then you don't want to bring grandma over because, you know,
she's older, she's more vulnerable.
Right.
Yeah,
you know, more exposed. So it was a dilemma there. And that is an example of many, but just probably more recent one. And so we had to really strategize. So she had to come out the out of her room. Unfortunately, she had to come out. Why? Because she had a child. But the child was of age enough that he could do some meals, so she would have to call him over the phone, the cell phone, to describe to him, what do you cook today?
Wow.
This is what I want you to prepare, right? Kind of makes you kind of grow up a little bit. Honestly, they're about 11, 12 years old. It probably was good timing anyway in some ways, but for sure it had to do some of that, right? And then also strategizing what times a day that she was going to be using the bathroom, or he was, particularly in her case, because she was the sick one, she would need it more frequently. So what they tried to do was navigate that. They would coordinate if he was in there, that he needed to let her know that that was what's happening, right? So that when she went in, she would go in and then she would bleach everything down and then bleach everything down afterwards. And then she would wipe the doorknobs down as she went back and entered back into her space, and then disinfected the area, the walkway space.
Let me stop you for a minute there, Dr. Z. So if she's cleaning as she goes in, and she cleans as she goes out, is it because she's the one doing the cleaning? Is she still potentially infecting or exposing that area?
Not necessarily. And the reason that is because she's the one, again, she actually does have gloves in her case. Not everybody. So there's a lot of strategy that happens. Depending on the situation, you just try to uniquely, help them navigate their situation. But no, not necessarily, because she has gloves, they're going to discard of that. And when you're touching a doorknob to exit as well, by that point, she's wiping the doorknob down. That piece comes with her. New clinic wiping that doorknob down, and then she can enter back into her room. Gotcha. So when she actually leaves, nothing she touched was actually contaminated based on the way she's cleaning. Long as she's, again, applying those strategies to the situation. And very, very difficult. Very difficult.
And then should she then also have a mask on, the infected person? Oh, I guess everybody should in that situation.
Yes. Yes, she should. And she should, and she did.
Yeah. Dr. Alexea, what else can you share as far as good tips, important tips, essential things for self-quarantining if you are in the home with other people?
So I'm so glad that Dr. Zarinah mentioned cleaning the door handles, because, I think about Cuomo and his situation being ideal for social distancing, yet the virus was still transmitted to his wife and his child. What I imagine is, coming in and out of the basement for the handoff of food or the handoff of more supplies, sending back the trays or the plates that you may have eaten from, right, to serve a meal. Even things as simple as using disposable plates and cups would be important right now to minimize the risk of spread. Or, resources are limited, so we don't necessarily want to be buying things and throwing them away. So if you have washing the dishes with gloves and picking up the dirty dishes with gloves would be an important way to slow down or stop the transmission of the infection, when somebody can't totally isolate, or how the barrier has been broken, right? Picking up utensils, dishes that have been utilized by the sick person, and now I'm taking them back into the main house to clean and prepare for the next meal, and did I contaminate other surfaces along the way? The other thing that Dr. Z mentioned was like utilizing a disinfectant spray, right? To, spray the air in the hallway between the bathroom and the bedroom where this mother and child are navigating the space. So that's something we've been doing in my office, even for our non-COVID patients. It's like we disinfect every surface. When a patient enters and leaves our office, and we only have one patient in the waiting area at any given time, our parking lot has become the waiting area. But when the patient leaves, we go behind them, we disinfect the outer door, the inner door, the countertop where patients stand to check in, the doorknobs that come from the waiting area into the exam area, the bathroom doorknobs, the exam room doorknobs. We spray disinfectant into the air, and we disinfect every surface in that exam room before another patient can come in. So the chairs, the exam table, the faucet handles, the countertops, everything gets wiped down. It's what we call a terminal clean. Like if you were turning over a room in the hospital or an operating room or something like that, you disinfect every surface that somebody might think to touch, because I think that's where people are missing the mark.
Yeah.
You know, once somebody's sick, they're scared enough to like back, give me my 6 feet. But and to wash their hands and all of those things. But I just think that we don't think about the doorknobs. We don't think about faucet handles. All that hand washing is wonderful. Cell phones, absolutely. Things that we commonly touch, that we pass between each other, that we lay on different surfaces. We have to consider all of those things as means to transmit the infection. We have to let go of the idea that I can only cough it out or sneeze it out. And I think we're getting a handle on breathing it out on other people, but we're still missing the mark on the objects, or the fomites, we call them.
So you said that you recommend paper or plastic silverware, paper plates or something like that. But if that is cost prohibitive, make sure you are wearing gloves to transport that silverware and plates and stuff in and out of the area where that person is.
Absolutely.
Staying. Yeah.
I would even go as far to say, for those individuals who you may have the opportunity to have two bathrooms in the home. I'm gonna take that scenario just a little further. And again, if the paper and plastic is cost prohibitive, then I would still maybe encourage you to have your set of plates and your set of forks and spoons, and so forth, so that when you go to that second bathroom, that'll be your bathroom, and you can actually wash and clean your own dishes and take them back to your bedroom with you. If that's a situation from that perspective, or you clean the dishes and whoever's assisting you with meals, you can leave the clean dishes in that second bathroom or outside the door, but be a little bit more deliberate about if you actually have the option for, you still may have to come out the bedroom, but there's a second bathroom that you could utilize, so that you could potentially try to just reduce, again, it won't be foolproof like to zero, but try to reduce some of that transmission to whoever may be a caregiver in that setting.
Would you even say too, as far as the plates, and I love that you say these are your set of plates, as long as you have these are the set of plates you'll be eating out of. Should they also then maybe put those set of plates, if they put it outside the door, in a big plastic, plastic bag or something like that? Is that
that can be helpful? I mean, if you have, again, the access or the wherewithal to do so, the idea is, again, the person who retrieves them, ideally they would have gloves so that they can, they're not picking it up with their bare hands. So be it in a bag or not in a bag, if that's option and possibility. But definitely reach out to your physician, reach out to the healthcare provider, so that you may say, I just don't know how to navigate this. Can you strategize this with me? I do that regularly. So that's sometimes, like Dr. Alexea pointed out, is half the battle. They just don't know how to navigate their situation, and we want to help people as much as we can. So,
and here's the other thing: I don't know that people always feel comfortable even talking to their physician like that. People may be afraid. Oh, I don't want you to think I'm stupid, or I don't understand, or I don't know. Everyone doesn't have a good relationship with their physician. Some people's physician are just their doctor, who they go to, whatever they go to, and they don't really communicate with them about their needs. Maxine Moses said, don't forget to wipe the light switch too. Light switch definitely is another thing we're probably not thinking about. Kathy Corbin, thank you so much for watching. She says, great information. Thanks for sharing your knowledge. Clyburn Sodden says, wonderful information. Need more of this. Thank you, ladies, so much for watching. We are talking to Dr. Zarinah Hudd. She's in Atlanta, Georgia. She's a sports and integrated pain specialist and a person who was quarantined after being exposed to someone with COVID-19. And then Dr. Alexea Gaffney is a triple board certified infectious disease specialist in New York. We're also talking to Dr. Nicole Edwards. She's a general practitioner here in Columbia, South Carolina. We're talking about self-quarantine 101. Anything else you ladies can share with us as far as good information and tips that we need to know if we are trying to self-quarantine, particularly people who are in small spaces? I mean, if you got a big old house, just stay on your side and I'll stay on my side, basically. But if you're and I think more people than not are in smaller, smaller environments.
Well, I just wanted to say, in response to what Dr. Z was saying and what you were saying too, Trey, is that you're right. Everybody does not have that relationship with their doctor. Right. The nice thing, though, right now, with the pandemic. And I think we're going to start to see how healthcare in general is going to be making a shift.
Yeah.
But there are many practices right now that are offering free consultations with their doctors or with their consulting nurse or with some kind of provider in their office where you can get advice, you can ask questions, and it's a lot of it's through either telemedicine. Some of them do phone, but most of them are doing telemedicine. It's something sometimes about seeing you face to face, even through a screen, but it's still face to face. But there are lots of offices out there right now that are offering consultations. Even insurance companies right now are paying for, we call it the COVID screening. But if you are having symptoms, then you need to be doing that screening, right? And part of that screening should also be some form of consultation in terms of how can we prevent the further spread of this, right? And so if you don't feel comfortable to talk with your doctor, believe you me, you can find a physician or a practice somewhere where somebody can give you some information, and just make sure that you're getting information from a credible source. Okay, so your cousin Pookie and them who work at the office down the street, that might not be the best source, right? So you want to actually make sure that you are getting credible, real knowledge and information. And like I said, there's lots of practices right now that are doing telemedicine screenings and telemedicine consultations. And so if you can't get in touch with your doctor, believe you me, you can find one that can. I believe all of us, we're offering screenings. We'll give you a couple of tips or pointers. You can probably follow most of our pages on social media. We're constantly trying to get the word out and get the education out so that people can. Knowledge is power, y'all. And the more you know, the more you can prevent, right? And that's what we're trying to do, is we're trying to prevent the second wave. We're trying to prevent people from getting worse. We tried to flatten the curve, and we did a little bit. We want to make sure that curve doesn't go back up. Okay. So we want to make sure that you are getting the knowledge and the information. And
especially in the African or the Black and brown community, because we are the people that are most affected and terminally affected by not only this, everything pretty much. And it has a lot to do with those underlying conditions. We've got the high blood pressure, we've got the sugar diabetes, we've got the heart disease, the asthma. And it is, unfortunately affecting those Black and brown communities. So anything else that you ladies can share with us, not only about self-quarantining or about the disease in general?
Well, one more thing that I do want to share, and Trey, we talked about this earlier in the week, but hey, maybe somebody is listening to this broadcast that didn't hear the one before. Just because you get a negative test, it doesn't mean that you are home free. All right, you can be negative today, and you can walk out of your house and you can get it later on that day, right? And you can have a negative test and still there be a 30 to 35% that you still may have it. So I'm encouraging people to get tested, but don't let that test make you lax in how you are being preventive for this. And if you have a negative test, but you're still feeling symptoms, please continue to reach out to your doctor. I really think that's why we're seeing another reason why we're seeing high rates of mortality in the African American or the Black and brown community is because we're either getting a negative test, or when we have symptoms, we're not being believed about our symptoms. Okay. And so if you are short of breath, if you are having a loss of smell, if you are even having GI symptoms, if you are having weakness in your body on one half, if you can't smile, if you're having stroke symptoms, heart attack symptoms, please, A, don't be afraid to go to the hospital. Okay. And B, please, if they send you back home, it doesn't mean to go home and stay home. It means go home. But if you get worse, or if you're not getting better, you need to reach out again and then go back. Right. And don't wait until you're crawling in on your last breath before you go back. OK, sometimes it takes, unfortunately, especially in the Black and brown community, it takes being persistent, and it's that squeaky wheel that gets the grease.
Yeah. And we may or may not like it, but it's the truth, and they are facts, and we still have to do what we have to do. We've got to save ourselves. We've got to take the initiative to save ourselves. Like you said, Nicole, the squeaky wheel gets the oil. And if it comes to our health care, our livelihood, we've got to do that. Either one of you ladies want to say something in close? Dr. Nicole, Superior's cheering on his wife. Tell him, Dr. Nicole.
I love it.
Why, Superior? Because she hollers at you like that.
Exclamation points. I did want to share. First, thank you again for having us. Honestly, it's an honor to definitely share, continue to share and advocate, like Dr. Nicole just said. We really are trying our best to push and educate and inform with accurate information so that people can feel empowered and not fearful and scared. This is not every time you see COVID-19 at the title of a video, it's not to scare you, it's to inform you, to empower you. So we're not at the stage where you can get weary. Don't get weary now. Stay diligent, stay informed, and stay empowered by the information, the accurate information. One thing we didn't really touch on a lot was, again, there's not a definitive treatment for COVID-19, but in terms of prevention, which I'm big on, as well as if you were to experience the symptoms, we want to, definitely press the point. We're physicians here, right? So we want to make sure that you're also hearing the other message, which is to get into yourself, so to speak. And getting to yourself as it relates to really, I would say optimizing and not boosting your immune system. I say optimizing because the boosting implies that you're at a good level and you just try to boost it up higher. Many of us are not at a good level. Our immune system are depressed, quite frankly. So we want to be doing things that are going to encourage optimization of our immune system. And that does come into the form of eating. Even if you have the virus or if you are potentially at risk and at risk for getting the virus, which is pretty much all of us, you want to make sure that your food and your lifestyle, your mental health, your physical health, that you're doing a little bit a day. I always say everybody has 15 minutes because it's a fact. We all do. And at some point, 15 minutes a day in all those three areas and categories, we have to be doing something that is going to be optimizing our immune system because we know that sunlight with vitamin D optimizes our immune system, okay? We know that physical activity does that as well. It optimizes our immune system. We also know that there's nutrients and vitamins and minerals that do that as well. So ideally through food, but if you don't have that conveniently to you as well, then there's vitamins and supplements and such. But identify any of us or someone to make sure that you please don't consider this, I'm damned if I do, damned if I don't, nothing I can do if I get it. Not true. We are a human body, and this human body is quite powerful. It just needs the right fuel to make it run to this optimal stage, and we actually have the power to give it the fuel. It doesn't just get fuel but from osmosis. So we do have to be deliberate and intentional about our health and about us making sure that we're optimal. So should you get it, it may not be deadly. You can actually, get recover and get through that because you're doing the things now to optimize your immune system and your overall health so that it doesn't take you out, even if you were to contract it in the event that you did. So I just wanted to kind of add that piece that, I think is really, 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 really important.
Yeah, take some preventative measures, Dr. Z.
Take some preventative measures for sure. Before, ahead of time, our blood sugars. We know if your blood sugar not right. You know, not right. Okay, we don't like to act like, oh, I got that bad sugar. I'm gonna get that COVID-19. Oh, we can do something about that now, right?
Put the cookies down.
Yeah.
Put the cookies down and put something else in there, right? We want to do anti-inflammatory. Disease, cancer, all of these diseases, they love to feed off of in an inflammatory environment. Hence sugar will do that. It's going to create more inflammation. Probably another conversation for a different day. But the main point I wanted to say was we can do something about it. Be empowered, and we can do something about it. We can be preventative, yes, in terms of just our lifestyle. I don't say where there's a prevention for COVID-19. I'm not saying it in that lane, but I am saying if we focus on optimizing our health and our immune system, that we have a better shot at fighting anything that tries to attack us or traumatize us or take us out. That is what I'm saying.
Yeah. Good stuff.
Real quick, Dr. Alexea, can you talk about how long someone should be self-quarantining?
Sure.
As we get ready to.
Yeah, and I would have wrapped up with exactly what Dr. Zarinah said, and I'll add to that. Just make sure you're taking care of your mental and emotional health and taking care of your spiritual well-being. So if it means shutting off the TV and stop watching the number of cases and the death toll rise, please do that. Like, limit your exposure to the negative information and the negative energy around this. Don't worry about the conspiracy theorists and where did this come from and all of that. It doesn't matter where it came from because it's here and it's attacking and it's killing us. And it's just another level of stress. So your mental stress creates physical stress and disease. It creates inflammation in your body. It weakens and suppresses your immune system. So you want to be in a healthy mind state because where your mind goes, your body follows. So absolutely, I would have said exactly what Dr. Z said in terms of taking care of your physical vessel, but also take care of your mental health and your spiritual health and well-being. In terms of if you get infected or you get exposed or you have symptoms, how long should you isolate? 2 weeks is the minimum. We know, and we're proving time and time again, that people who have detectable virus in their respiratory tract and you swab them again 2 weeks out, 4 weeks out, even in the extreme of 6+ weeks out, some folks are still shedding virus, which means they're still contagious to other people. So you cannot make the decision that I had it, I feel better, and now I'm done. So from the time your symptoms go away, your fever resolves, a minimum of 2 weeks from that time. Not from the time you got exposed, not from the time that you got symptoms, from the time your symptoms resolve, a minimum of 2 weeks. Now there's more testing kits available, so people should be retested and should have 2 tests at least 24 hours apart to make sure that they are truly negative and are no longer spreading this virus. And again, keep in mind, was it a good sample or not?
Yeah. Dr. Alexea, if people want to contact you or get some more information, how can they do that?
So you can find me on Facebook, Instagram, and Twitter at Dr. Alexea, so DRALEXEA, and look out for the launch of dralexea.com later this month.
Awesome. And Dr. Z?
You can also find me, I'm Dr. Zarinah. You can find me at Dr. Zarinah, actually DRZARINAH across all social media platforms, Instagram, Twitter, Facebook. And I'm also at www.drzarinah.com, where you can also find me, reach out to me, the screenings, as Dr. Nicole talked about, telehealth, options, as well as a supplement line to make sure that you can optimize your health. Don't forget that code. So yeah, definitely. We can do this, ladies.
Absolutely. And Dr. Nicole?
And you can follow me on all social media platforms at Dr. Nicole DO. That's DRNICOLEDO, as well as drnicoledo.com. And again, like Dr. Z said, you can go on there. It says COVID screening. There's a 10-minute complimentary question and answers that you can get as well. But all social media platforms and the website. And we're always giving information. We just want people to be empowered and to have the most accurate information. And as we get new information, we're going to update it.
Absolutely.
So all of these ladies gave you their information. Contact them if you have a question, a comment, a concern, not only about self-isolation, but anything concerning COVID-19. They're making themselves available. So let's take advantage of all of this great information. I do want to mention that Yvette McQueen said, go to the ER if you're sick. They're still seeing patients. That's something else that we talked about last week, Nicole, is, not to be afraid because of this to go to the ER. If you are sick, go to the ER, please. And thank you. Go to the ER. Ladies, Allison Leslie Aristide says, great information. She's watching from Florida. Thank you so much, Allison. We appreciate it. Ladies, thank you so much. This was great, such information. And we just pray and believe that someone will get empowered and educated and informed. Please continue to share this out so more people can get this great information. As usual, I leave with a reading from Jesus Calling. If you ladies will allow me to read the one from today, May 1st. It's always on time whenever you read it. This is Jesus talking. He says, "You are on the path of my choosing. There is no randomness about your life. Here and now comprises the coordinates of your daily life. Most people let their moments slip through their fingers half-lived. They avail the present by worrying about the future, by longing for a better place and time. They forget that they are creatures and are subject to the limitations of time and place and space. They forget their creator who walks with them will only walk with them in the present. Every moment is alive with my glorious presence to those whose hearts are intimately and ultimately connected to me. As you give yourself more and more to life of constant communication with me, you will find yourself with simply no time to worry. Thus, you are free to let my spirit direct your steps, enabling you to walk along the path of peace. Please continue to post and share this information. Hey, Nicole, can you tell everyone about the guests that we've got on next week, Tuesday? If your baby, if your child who is too young to really articulate is experiencing or displaying some behavioral problems, it may be because they are acting out because of what's happening.
Absolutely.
And Nicole has put together another excellent panel of physicians to talk about that. So that's going to be a 9 o'clock after bedtime, coping with COVID.
Once the kids are in bed.
Then come listen to that. Tell us about the ladies that you've assembled, Nicole.
Yes. So it'll be Dr. Alicia Ellis Cox. She is a child and adolescent psychiatrist. Mm-hmm. And then Dr. Ebony Hollis Smith, and she is a developmental and behavioral pediatrician. So I think she's like triple board certified as well. So yeah. super panel of physicians who deal with children and their behavioral health, and not just the children, but also the parents, and how our behavioral health impacts our children's behavioral health. Absolutely.
Yeah, so that's going to be Tuesday at 9 o'clock. One more question for Dr. Alexea, since you said that about the other doctor. So again, I'm not a doctor. So do you have to take the you got to take the test 3 times to be board certified, triple board certified?
So I did a dual residency training. So I trained in internal medicine and pediatrics at the same time. So I took a board certification for each of those, and then did an adult subspecialty fellowship in the infectious diseases. So I'm trained and boarded in infectious diseases as well.
Okay, so that's like if I get an award in radio, TV, and print, I'm right. I just had to break it down like I can understand it. You know what I'm saying? Okay, thank you, girl. I know y'all didn't know either, so that's ladies, thank you so much. I've got 2 new sisters. Thank you, Nicole. I am so honored and pleased to connect with you guys. Definitely want to get you back on. If there's something that's going on with the pandemic that we need to know about, please share with us. I already talked to Dr. Z about coming on. We're going to get an actual COVID-19 patient who's experiencing, dealing with it here in Columbia, South Carolina. He's going to come on next week, and I've asked Dr. Z to come on. Dr. Alexea, you're in my hometown. You're always, well, this girl, we could hear the accent coming through. I don't know if y'all heard it. But you're right there, girl. You're right there in the epicenter. So please be careful. Take care. Stay safe.
Thank you.
And ladies, thank you so much. Thank you so much once again for watching Coping with COVID. In addition to the show on Tuesday, tomorrow, we are going to talk to South Carolina State Representative Terry Alexander. He's in the Florence, South Carolina area. So if you are in the PD, please watch. Thank you again so much. You guys have an amazing weekend. Stay safe. Be careful. Remain blessed. And wear you a mask or 2.
Yes. Thank you for having us.
Thank you.